in 2001. Zambia was part of the participants that were in Gaborone to learn more about artificial intelligence use in public health. But one of the outputs was that of forming the community of practice for EBS for Southern Africa.
Working with African CDC has actually enhanced our understanding of importance of event-based surveillance at national and international level.
The event-based surveillance framework of Africa CDC has been to operations for the past 4 years, and there are a couple of things that have taken different changes. And to reflect this into context of the current situations, we also provided technical support in the revision of or updating the event-based surveillance framework of the Africa CDC.
Donc, depuis 2016, la Tunisie est en collaboration avec la GIZ. Nous avons commencé à mettre en place la surveillance basée sur les événements, dont l'objectif est de détecter des événements de santé, de pouvoir les évaluer.
In 2022, Africa CDC established the Event-Based Surveillance Committee of Practice as one of the strategies to improve collaboration between member states in the region towards strengthening early warning and response.
Looking at the domain is obviously event-based surveillance, but in terms of the advantages of being part of the community of practice is that we've shared information as relates to guidelines, policies, the issues around sharing surveillance information in terms of sharing weekly bulletins across the country. So we've had also support from the Regional Afro Operation Center through the surveillance department in terms of sharing the updates which they are picking up from our region as it relates to surveillance works.
This collaboration, SATSIDS, has now becoming an authority in event-based surveillance, especially in technology-driven solutions. For instance, we are now collaborating with ministries and member states to integrate systems, especially in early warning systems. For instance, in Tanzania, we are now working with the Prime Minister's office to develop a digital One Health surveillance where various sectors are now able to share events from the community level.
Over a decade, SATSIDS has been championing One Health approach to enhance multi-sectoral and participatory approach in early warning and response to health emergencies, of which is a core component of EBS framework of Africa CDC.
Also, when you consider SATSIDS as a regional networks, it's easy to support mission of African CDC because it has already experience of working in a Southern African region.
Nous avons aussi récemment donc renforcé la surveillance basée sur les événements par un élargissement des sources d'information aux sources communautaires et par la surveillance basée sur la communauté.
We adopted a teach-back mechanism where we supervised the training of event-based surveillance at the national level and also the sub-national levels, including the community level. We also provided technical support in developing or establishing the multi-sector technical working groups to support the operationalization of event-based surveillance at the county level, especially in the Eastern and the Southern Africa.
CDC has enhanced us to build the capacity on developing training materials which are African-centered, and also standard operating procedures and guidelines which has helped our countries on implementation of event-based surveillance.
We have the issue of flexibility and readiness of SATSIDS to support preparedness and response to public health emergencies, and therefore fitting very well to EBS concept.
This is a platform that we need to sustain. Currently, it's really a platform for surveillance, not for individual countries, but for security in the region. So it's another activity which member states need to participate, but in a structured manner, using framework, guide, and a monitoring and evaluation tool.
Les avantages avec cette communauté, c'est d'avoir des points focaux qui sont identifiés par chaque pays, mandatés par chaque pays, et donc ils peuvent parler des événements de santé sans problème de confidentialité. Aussi, grâce à ce groupe, on se réunit même si on n'a pas d'événement de santé. Comme vous savez, le cas zéro.
Now we have benefited from networks and collaboration from Africa and beyond, which now acts as a leverage for us in terms of resources and experts, where we are able to share our strength and address weaknesses in surveillance systems.
We really need to model it in a structured way that speaks to health security in our region, as all of us are participating to start prioritizing the aspect of disease that we really need to monitor.
We supported development of a monitoring evaluation plan to support the countries monitor the efficiency of implementation of event-based surveillance activities.
Aussi, ce que je recommande et qui va vraiment permettre de maintenir cette activité, c'est que le point focal ne soit pas une personne, mais une cellule.
It is a platform for member states to exchange information in real time, share experience in implementing event-based surveillance, best practices, operational tools, strategic and work plans that will be beneficial to the member states. This event-based surveillance committee of practice has been established in the Northern, Central, and Southern Africa regions, and this year we are working to establish the committee of practice in the Eastern and Western Africa regions.